So the title of what I'm doing today is Hearing Loss and How Licensed Hearing Aid Dispensers Help. I know I got a wonderful introduction about who I am and a bit of the history. I wanted to explain a little bit about the differences here, but I want to start by my own certification of audio prosthologist. What I think there needs to be more of in my industry is education and advanced certification. And you'll hear a little throughout my talk here about some of the minimal things it takes to start with what I do, but a lot of us have gone on to further advance. And to be an audio prosthologist, you have to go through a 13-month certification where you get trained on some of the advanced fitting techniques and advanced ideas in this industry and what it entails. So when you hear that, I'm not a doctor by any means, but I have continually tried to better myself through education and what's available to me. And my family's been doing this for 50 years. So long before my father was my grandparents. And so I feel a great honor to be a part of the lineage that we have in the history of hearing aid dispensers in my family. My next step this way.
Can you hold on a second?
I can.
Alan.
Okay. I'm seeing his presenter view.
Oh, shoot.
On the screen, and I
You
don't.
are. Goodness
It doesn't
gracious.
bother me myself, but it may look funny in the recording.
Tell you what, I will switch that when I did the test on it. Here we go. That's the one you want to see right there.
That's
So-
better.
I will continue. I do apologize about that. When we
No.
did the test, it clicked up that way, but I'll continue from this point. And thank you.
But it was larger before. Looks
Oh,
like
yeah.
the image is smaller than what you showed before.
Oh, the current image. This is the screen that I had. Oh gosh.
Yeah, it looks fine to me.
I wonder if it's your computer, if it needs to be maybe
Looks okay to
maximized.
me.
Okay. Okay. Is it okay if I'll continue there, Sarah? Or do you need?
Is that okay, Alan?
It looks fine.
Okay, yes.
Oh, no problem. So as a recap, again, additional education to become the audio prosthologist that I am. Let's go this way. So along with the hearing aid centers that we have, I do staff 2 other licensed hearing aid dispensers, and I do have a trainee currently, and I do have 3 to even 4 patient care coordinators, and we can work with most manufacturers, and I'll talk a little bit about this as we go along, but we do tend to work with a manufacturer called Starkey. It's just one of my favorites, and my family's been working with them for quite a while. So in addition to running my practice, I'm an advocate, and it sounds like this association is also very much advocates. I've been on pretty much every position for the Hearing Healthcare Providers of California board. I'm currently the immediate past president. We do conferences and education and advocate for the consumer rights and also for the licensing of hearing aid dispensers to be a continual thing. I'm part of the International Hearing Society, and I've been a member for over 15 years. And that's our more national association that we're a chapter of. I've also served on the Managed Care and Compliance Committee of that association, where we have designed a compliance book for people like myself and other hearing aid dispensers that want to work with health insurance and work with managed care in order to provide those benefits for the consumers and patients that they do see. I also work with the Department of Consumer Affairs here in California as a proctor. It's been a few years since I've done that, but I did it for several years. And I've also been in several workshops where we design the testing that's necessary when it comes to licensing, which we'll talk about in a little bit. Currently, I'm also monitoring a hearing aid dispenser that was on the verge of losing a license. And I'm trying to be a mentor and help him learn better and get through his probation so that he can once again be in good standing with the state of California. So I like to be a part of of the solution as much as I absolutely can. So a hearing aid dispenser, I mentioned this a bit ago, in its most basic form here in California, must be 18 years or older, must be fingerprinted. That's kind of the obvious thing. You have to be a high school graduate or an equivalency. You also must pass a California written exam and a practical exam. That's been that way for a long time. And as you see, that's kind of a minimal thing. It doesn't say a lot, but in order to pass a written test or pass a practical, there's a lot of skills, a lot of knowledge that you have to have in order to be able to do that. And I specifically, being in the workshops that wrote those several times over the last, 10 years, it's a hugely intuitive, involved process to design these tests. However, you still, it's a minimum requirement, and there's a lot more that needs to be learned after that day. So I got one question about what is the difference between an audiologist, which you may have have seen audiologists before, and what a hearing aid dispenser does. So an audiologist, they go to a program, many years of a program that gives them a doctorate in audiology, where they are able to diagnose hearing loss and treat hearing disorders. So it's really about the hearing. How does the hearing mechanism work, and how does the diagnosis come forth so that further treatments can be done? The scope of a hearing aid dispenser is to perform hearing testing in order to determine if someone needs a hearing aid. So it's a non-medical exam. It's mainly to tell you if someone has a hearing loss. We perform case histories, which is sitting down and getting to the root of what the problem is. A lot of it's subjective in that case as to what is the person experiencing, what sort of difficulties do they need to have a solution for. And also we're looking for, and are trained to look for, disorders of the ear as they present to the patient, as they present in the test. And we're a great referral to an ear, nose, and throat doctor, or even primary care, in order to make sure you're getting medical clearance prior to selling any kind of a hearing aid. We only work with patients over the age of 16. It's in our license to say that. However, in cases where a pediatric patient would like to see a hearing aid dispenser, we just require having an ear, nose, and throat doctor's prescription and have an audiologist recommend the product, and then we're able to take it from there. Ultimately, for an audiologist to work with a hearing aid in California, they have to pass the same licensing exams that we do. And I'll correct myself. It used to be both tests. An audiologist is only required now to pass the written because of the curriculum that they've passed in their doctorate program. So we're both licensed under the same board in California, the Speech Language Pathology, Audiology, and Hearing Aid Dispensers Board. We call it SLAP Happy in our just kind of funness of the board, our Hearing Healthcare Providers Board, because it's easier than saying all of those words at the same time. The next slide here. So I'm going to get into more specifics of what a hearing aid dispenser does. And a lot of this will be familiar to you guys because you've maybe done it on audiology, or you've been diagnosed with hearing loss in the past. So the first thing is we have to do a hearing test. If you remember through your hearing test, there's lots of bits and pieces of it, but this is what it entails. Ultimately, there's some sort of a pure tone testing. And so if you remember either pressing a button or raising your hand when you heard a beeping sound, we test the air conduction, meaning how sound comes through the air and actually hits your eardrum, then goes through the mechanism of your middle ear into your cochlea. We test bone conduction, which sends sound, tonal sound, the same sort of beeps, directly through the skull to the cochlea. And there's a comparison between those two tests that we look at to make sure the sound travels through the air at a very much the same pace it travels through the skull, in order to make sure that there's no middle ear disorder disrupting that sound. We also do what's called a threshold of discomfort test, where we find out just how much volume is tolerable and right at the uncomfortable level of the tonal responses that we do. It helps us when it comes to programming hearing aids, because you can't wear a device that is louder than you can tolerate. You'll just take it out of your ear, or that, because that's natural human nature there. The other thing that's done is called speech testing. And speech testing is using either a live or a recorded voice. And we look for several aspects in speech testing. The first thing is how softly you can hear. That's called the speech reception threshold. So it's done with 2-syllable words and finding the point where you just can't hear it anymore to where you just start to understand it 50% of the time. And that score is marked in our testing. The most comfortable loudness test is a point subjectively, where we usually do a speech test called running speech or rainbow passage. And we find out where subjectively you feel that that's a good volume comfortably. Maybe it's not as clear, but it does feel comfortable to you. Then there's the uncomfortable loudness level. This is similar to the threshold of discomfort, but done again with a speech stimulus to see where voices feel comfortable to you. The last thing, the next listed here is word recognition score, or WRS. That's one of those real telling tests when it comes to how a hearing aid can work for somebody. And I know that through speaking at the beginning of this course, there is multiple cochlear implant recipients in this association that you're in. And the word recognition score is one of the things we look at. When it starts dropping below a certain point, we are trained, and again, more in our advanced training, to refer that out for even a cochlear implant evaluation and see if maybe that's the next step. Because just because it gets loud doesn't mean it gets any more clear for you. Some additional hearing tests that this first one is really one that I love, is called the quick SIN, or speech and noise test. I put a lot of weight on this test among the others, partly because if you want to hear well in noise, which most people who can't hear or need hearing aids, it's usually the noisy environment where they feel the worst parts of their lifestyle. This test gives us at least a good idea if they could be able to hear in that, if the potential is there with amplification and the advanced technology in hearing aids nowadays. It's 6 sentences. Each sentence has more background noise behind it than the one prior to it. So what we get is a score between -0.5 to 24.5. And the higher the score means more difficulty in noise. In a sense, you have to have, if someone has a 24.5, they need someone's voice to be 24.5 decibels above the lowest level of noise in the room. That's a very difficult area for most hearing aids to reach. And that person may also have word recognition score issues. There may be even, again, cochlear implant possibility for referral there. But if somebody is maybe 10 or 15, hearing aids can clean that up nowadays. 20 years ago, we couldn't do that when I first started, but the last few years, technology can. So I love that test, and why even talk about it more there. The next test that's listed here is called tympanometry. Now, it's good to delineate hearing aid dispensers in California. We're not allowed to perform tympanometry. The test is, however, to determine the middle ear functioning. It's a great test in addition to having that air conduction and bone conduction test from the previous slide. They both can point to different parts of the hearing and how it's working, and can lead a physician to a diagnosis of maybe a middle ear disorder, something along those lines. I personally do work for an ear, nose, and throat doctor at one of the hospitals in town. And when I'm working underneath his guidance and his supervision, I do perform tympanometry, and I do see the differences between those tests. So I do find it as a very valuable test, but it's not something that a general hearing aid dispensing office will perform. So I mentioned earlier in the scope, our hearing testing, it's not medical. Like I said, we don't diagnose. We only can do a hearing test to determine if there is a need for a hearing aid. So with our case history, with the hearing testing I just described to you, we're trained and licensed to be able to say, that looks like a hearing loss that would benefit from hearing aids. And patients have, and hearing impaired people have the ability to say, I'd like to get hearing aids. How do I work with the next step? And there's multiple ways. Most people can either say, they sign a waiver and say, I don't want to see a doctor prior to working with hearing aids, or they're referred to a doctor for any reason why there might be a best medical condition first. But ultimately, it's great to see your physician. It's great to see a doctor prior to working with hearing aids to determine there's no wax in your ears, and determine there's potentially no underlying conditions that might might be medically correctable even. So I'll talk about that on a further slide. So also the hearing testing we do goes into our computer system, and the manufacturer's software helps us design and kind of mold the sound into something that would be beneficial for the patient that we see. Excuse me. So I mentioned this just a second ago. We're required to have a good understanding of normal and abnormal ear anatomy, the physiology and disease conditions. So it's wonderful the FDA created these 8 basically red flags that we have that we want to look at. And I'm going to read through them because I'd like to read them verbatim here. But the first one is making sure there isn't a visible congenital or traumatic deformity of the ears. If the ear looks injured or looks like something that it can't hear because it's been sealed over for some reason since birth, usually there may be surgeries that are involved to help the hearing prior to a hearing aid. History of active drainage from the ear within the last 3 months, 90 days. Obviously, if we had that happening, we should be seeing a doctor, not putting a hearing aid in our ear, right? Visible evidence of cerumen or wax, or accumulation of a foreign body or an ear in the ear canal. If there's something blocking your ear, it could be preventing you from hearing your best. So you shouldn't have a hearing aid prior to having your ears cleaned out, or an obstruction, possibly not even a hearing test done in that case, because the eardrum is not visible to work with. Pain or discomfort, that's something we refer for. Dizziness, the balance and hearing mechanism is in the same area. The vestibular system includes your bony labyrinths, which do balance, and the cochlea, which do hearing, and they often work with similar fluids throughout them. So you could get disorders that give you a symptom of hearing loss and dizziness that needs to be seen by a physician. If there's an air-bone gap, which that is a difference between our air conduction, or the AC testing we talked about, the tones down the ear, and the bone conduction testing through the skull, if there is a difference between those two readings, it could point to specific middle ear disorders. And there's 3 different critical frequencies that we look at, where it could be you have otosclerosis, or you have some sort of a damage to the middle ear. And there's things that show up on the test that the doctor can look at and say, that looks like something we need to do further testing, not just hearing testing, and they can order those type of tests. If you had a sudden or rapid hearing loss in the last 90 days, that's another thing where time is of the essence. When hearing goes quickly, there's always a fear of if it's going to come back again. And so there's no reason to get a hearing aid. You should be seeking out emergency care if you lose your hearing suddenly. So that's something we need to refer for. And then a unilateral or a single-sided hearing loss of sudden, if your ear just suddenly changed. And so it's kind of like 7, but with both, with 7 was both, excuse me. 8 is just one ear all of a sudden drops off and can't hear with it. So those are all things that we're trained and tested on to make sure that we understand and are able to refer to the MD for that. So the other thing that we're able to do is recommend hearing devices, which is one of the best things we get to do. It's actually picking that solution that's going to make the difference for the patient. Every hearing aid wearer is different, and a hearing aid dispenser looks at the following criteria when they're recommending a hearing aid. The first requirement is whether or not how much power is necessary for it. More severe hearing losses require more need for power. How big or small is somebody's ear? A very tiny ear is not going to be handling a real big hearing aid. Also, a little tiny ear isn't going to fit a hearing aid that goes all the way down inside. So we have to figure out where the hearing aid is going to end up being. Dexterity can be an issue. Is the patient going to be able to handle a small hearing aid? Are they able to put it in their ear? Are they able to take it off? Are they able to change a battery or manipulate controls? All of those things have to go into it. One other thing I know that I didn't make it in my slideshow, but we talked to Sarah a bit about telecoils, and knowing if somebody's lifestyle, and usually in case history, we find out if there's places they like to go that has looping systems in it, or the type of difficulties you have, where can we fit that telecoil in a hearing aid? Because it is not a small part. It has to be done a certain way. And that helps us at least pick the different sizes and shapes that we need to do. There's several manufacturers that make hearing aids. I'd say there's the top 5, top 6 that are out there, and I won't go all by name, but each of them, as the similarities they have, they'll carry different styles. So I put on here the ITE, which is something that's in the ear. There's a few different sizes of the in the ear products. There's BTE, or behind the ear, and there's a few different sizes of how big the product is behind your ear. And the most recent, newest design, which is on the bottom left of my screen there, is called the RIC, or they've also been seen as the RITE, and the R part of that is for the receiver. The receiver is a name we use for the speaker. So this is a product where the speaker is separated from the hearing aid by a wire, and it goes in your ear, and that's all that's down in your ear. And it's been amazing to watch that technology first come to fruition back in, I think, 2007, 2008. And now what we're able to do with that, it used to be we had to have big old hearing aids on people, even with the mildest of high frequency hearing losses because of feedback. But now we can handle that with the smaller devices, and they're much, much more cosmetic. Every manufacturer has different levels of technology. And the way I like to think of that is it's the computer chip. Now, computer chips are designed to be absolute sports car workhorses, fantastic design devices, but those also come at a cost. So manufacturers release different product levels, and they reduce the pungency of what it can do. That's an interesting word, but the ability for the hearing aid to work in certain areas, and they lower the cost. The reason being, somebody who has a very quiet lifestyle, maybe is even on a fixed income, doesn't have a lot of noisy things around them. They may not need a product that's going to cost twice as much as what they need. So the manufacturer knows that, and we are able to pick that, because it's a lot about talking with the patient and deciding where they can budgetarily hear their best. Not everybody says sky's the limit. We have to be very conscious of that because it's important. There's now the type of batteries we have rechargeable batteries, and those have gone through multiple generations over the last decade. I feel that every manufacturer has really finally figured it out in the last couple of generations, where the reliability is becoming something where you'll see 40 to 50 hours on a single charge, and that's very realistic for us to be able to manage. Now, very powerful hearing losses may not do well with a rechargeable battery, because that will cut that maybe even in half because of the needs of power. So there's still a great need for battery operated hearing aids, and that's something that, again, we have to figure that sort of thing out and picking it with the patient. So ultimately, the hearing aid dispenser will recommend a manufacturer, a model, as well as technology level and battery type, based upon how effective we could predict that that would possibly be for the patient. Most of this last part, this fitting counseling and follow-up, is where most of the time is spent with the provider, with the hearing aid dispenser, or with an audiologist that's dispensing hearing aids. It takes time to get used to what's going on. So the fitting includes verifying that everything we picked was the right size, right shape, it goes on the ear securely, it's comfortable. I forgot to mention on the previous slide, it's the right color. I mean, you don't want a hearing aid that's pink unless you wanted a hearing aid that was black, right? It has to be verified that everything was correct. Verifying the sound, this is another one of the most important things I find, and that is what's called real ear measurement. And there are best practices out there. If you look up hearing aid dispensing best practices, you'll come across several people. Dr. Cliff Olson is one of my favorites, and he has multiple videos on this, and he is a huge proponent for real ear measurement. And it's a way to go through and really mold the sound so that it matches that hearing test and matches the predicted outcome that we want to have for the patient. We can see the speech intelligibility improvements that are predicted through that. It's more than just doing what's called a manufacturer best fit, where you click a button and the computer picks the way it goes. It verifies the sound is getting into all the necessary areas for improved hearing. So one of my favorites, feedback canceling. When I got in the industry 20 years ago, they started having these phase canceling technology inside of the hearing aids. It's gotten so great now to where we don't get whistling unless we just don't have enough power, as in the person's not going to hear it almost anyway. But with the right amount of feedback canceling, the right amount of occlusion, the right fitting on the hearing aid, we're doing amazing things now for clarity when possible. When there's sensitivity in someone's ears to actually get the sound, we can really hit it nowadays. Usage, picking all those different pieces, we have to make sure someone knows how to take it out, put it in over and over again. Sometimes we'll sit there and do this over and over with patients because it takes that sort of time. Turning on and off a device. If it's rechargeable, how do we put it on the charger? How do we take it off? Maintaining a battery, making sure that your batteries are working, that they're clean, and the hearing aids are clean on a daily basis. There's now wax prevention methods that help. So those are all the things that go into the fitting portion of it. Counseling is similar, and some of these things you'll actually find are what audiologists that are dispensing hearing aids are doing this same thing. So we really have we kind of come together in lots of our skill sets as a value to the patients. But sounds will always be louder, sometimes not as clear as what somebody expects it to be, but we have to be able to be realistic and have to perform the measures to make sure that we are getting everything that we intended out of the hearing aids. Voices are going to sound different. Your ears will need to get used to the hearing aids, so you don't want things that are uncomfortable. So that's something that is, again, lots of time is spent on that process. And then follow-up. This is after you've determined all of these things. A patient goes out and they wear the hearing aids for a couple of weeks, depending on the office of 2 to 3 weeks sometimes. when they come back in, you have to verify how it went. Subjectively, are they getting lifestyle improvements? You have to adjust the frequency response, which is the way it sounds, what we're able to do with our software. You have to check data logging. The hearing aids nowadays have data logging inside of them so that we can see what they've been doing. We can see usage patterns. We can see how the different features that we intended, how they're actually functioning, what they're actually doing. And this should be done several times throughout a trial basis on the hearing aids, which in California, there is one of 45 days once you're fit. This should be done several times throughout that process. And then during a year, even a couple times a year, patients should come back in and have that done. And sometimes the difference between a hearing aid dispenser and an audiologist in this is depending on how much time they have in their schedule. All we do is hearing aids. We don't have to do diagnostic testing. So our schedule is meant for this exact thing. And there's so many more hearing aid dispensers in California and in the United States than there are audiologists. That's a great resource for maintenance and care and keeping hearing aids working. Even if it's not the hearing aid that you got from that hearing aid dispensing office, they still have the ability to service, clean, repair that. That's how that works. Sometimes with a cost, but it at least is available. That's the big thing. So another thing that's wonderful is now the accessories that can be done with hearing aids. I'll touch on this briefly, but I know that Sarah had a device connected to her computer that helps her hear the sound of this talk, and it streams right into her hearing aids, which is amazing that they can do that. But they can do that with also the television. They can stream the sound of TVs into both. I'm pretty sure your cochlear implants have that sort of technology. I know that most wireless hearing aids and also partner microphones. And I realized the one slide that I left off of this was cell phone technology of being able to connect to a phone. And that takes time also of sitting down and adjusting and pairing and working. There's always just time involved in that sort of thing. But it's important because that feature makes it so you can now connect to your loved ones or your friends with both ears. You can hear the conversation going through both ears at once. One of the last slides I have here is and then I'll definitely do some questions. Over-the-counter hearing devices came out a little while ago. I think it was in 2022, in October of 2022, so about a year ago. One thing to be aware of is everything I was describing on this last few slides that's not in over-the-counter hearing aids. So beware of that if you're thinking of purchasing those. They're not regulated by any state law. They're all done through federal. So the California law to return a hearing aid in 45 days doesn't apply to these. There's also self-fitting. And if you perceive yourself as mild to moderate, you can self-fit yourself with the hearing aids. But all of the things that I described in the fitting process takes a little bit of learning. So we have found not much has come out of that process. I don't think we bought a bunch of over-the-counter hearing aids in order to have that available for patients if it was a cost type thing, and have had 0 people take us up on that. So at the time, you can see August 4th of 2021, when they were working on that, the Attorney General at the time, Rob Bonta, even put out and actually multiple attorney generals across the United States basically said, make sure you understand that it is best done with a provider. And direct-to-consumer products have been around a long time. This is just kind of a new idea, but buyer beware some. So I think that's all I have for my slides, and I'd be happy to elaborate further or answer any questions you might have.
Okay, so can you stop sharing?
That's my goal here.
Okay.
There it goes. There you go.
Thank you so much. You've
You're
really educated us. Now it's time for questions. You can put your questions in the chat or you can raise your hand. First off is Rich Osborne. Rich,
So, Joe, what
Rich
happened to batteries?
Osborne, are you there?
Can you hear me, Joe?
I can hear you, Rich. Yeah.
Okay, what happened to batteries? I have a number of these,
Mhm.
322s,
312, that's right. Yeah.
312, I'm sorry, 312s,
Yeah.
and I can't give them away. Nobody wants them.
Oh gosh, we use them still because through some of the insurance programs we work with, the rechargeable hearing
There's some
aid.
freezing going on. Rich and Joe,
No, we're not
freezing on
freezing.
my side of
freezing?
it. I wonder if it's
No,
your
we're not.
I'm
possibly.
okay. Tana, can you move? No,
Oh no, we
You just
lost her.
froze.
It looks like I'm still set as a host, so we're
I'm
continuing
still
there.
moving.
Yeah. I think Sarah's just going to need to click back on there. It looks like her computer might have gone haywire on her there. Should I wait for her to get back on to answer that question? I don't know if I need to proceed. I'd be happy to answer the question there, Rich, if that's,
Well, I don't know. You better wait.
I think you're very right. Let's do that. Well, I'm sure she'll be back soon. If I see her pop up on the screen, I will
But
let her
in the meantime, I'm going to augment my question.
Sure.
I have a new hearing aid that the VA gave me, and they want me to use these batteries, which are 13s. I've never heard of them before.
Mhm.
Do you know what they are?
It's actually the same voltage and amperage as a 312. It's just the battery door was designed and the power necessity was designed to allow that to go in. It's a larger fuel cell, if you think about it. It's the same exact type of battery, but it has a greater amount of fuel inside of it. So they tend to last longer, and they tend to be used with they tend to be used with hearing aids that require a greater deal of power so that you get a reasonable amount of battery life.
Does that mean I could use these 312s in my hearing aid?
Only if you were a wiring wizard and could run electricity out of your hearing aid into the battery. The
No.
issue is that the battery was designed to go in the door that you have and to attach to those contacts and then fire up the circuit and the pieces. So it wouldn't fit. And
Okay.
and it looks like when you put those in, you might even be able to stack two of the 312s on top of each other, but those don't fit either. So it's specifically made for the battery door with the same exact power as the other type.
So my question, why is it nobody wants these? I've tried to give these to my
I
hearing
use
club
those.
and
I
nobody
use
wants
those all
them.
the time, so I'm not sure. We use those all the time, and partly because when it comes to some of the health insurances that are out there, they require it's sticky on the rechargeable batteries because of the way that repairs happen. They don't repair chargers if it was broken. So we opt to go with a battery powered hearing aid. It's the same hearing aid, but it uses that 312 battery. So we still do quite a few of those 312 batteries. I'm not sure it's just your area or community. Maybe people aren't doing many of those. So, but
Okay, thank you.
no problem. You can go on eBay. I don't know. I don't see Sarah back here. I wonder, see if she's texted me at all. I'm not sure.
Because I just wanted to give them away and nobody wants them.
Yeah. Yeah, I'm not sure what to say about that.
So I have a question. Joe, first of all, thank you for being here with us, but I'm really curious about how hearing aid dispensers are trained for ear molds and ear mold decision.
Yeah.
And it seemed to me, I've been deaf since birth, I wear power hearing aids, but in a lot of the hearing loss groups that I'm in, there are constant frustrations and questions, and to me, misfits of hearing aid molds. And so could you speak to training and could you speak to how we can get this better?
I would love to I'll give you my honest opinion, and I've trained, gosh, at least 5 or 6 hearing aid dispensers in the last 10
Yeah.
years. And it is one of the most complicated things to grasp. And that is not just the making of the mold. That's something that can be trained to almost anybody. It's how much occlusion the mold has to have, how big it has to be, how small can it be in order to be able to retain the sound necessary, and also to be able to give you venting to allow the hearing aids to not feel like you're plugged. The most classic problem that I have seen in my trainees that I've audited, and even some of my dispensers that I've audited over the years, one was even a family member that we had a conversation, was not occluding someone or using a mold when they should have used a mold. Molds equal more power, and molds will, or molds equal retention. And molds have to be made all the way to the eardrum, or else you're missing the bends. So the question is, who trains? People that know how to do it train. The manufacturers over the years, now pre-COVID, had lots of things where you could go back and have a training at a manufacturer. They would show you how to make the best molds. I know at Hearing Healthcare Providers of California, at our conference, we did some training for that a few years ago in our Rohnert Park. We had training on how to make molds and how to do in-office molds, in fact. But there is no curriculum that is like required. There's no school that's required for a hearing aid dispenser to go to. It's mainly an apprenticeship, and it means a good hearing aid person teaches and creates a good hearing aid person. And then the test is the next step. And one of the things that it's in public knowledge, when we are tested in our practicum, we have to make molds. Everybody knows we have to make a mold, and we're critiqued on it by our peers of how we do that process. So it's really hard to pass an exam like that without being good at several aspects. And molding is definitely one of those that is up there.
Thank you for that. I know it's a complicated process, but as I said, it just feels like it's a constant topic of discussion among people and frustration. So I wish that it was a better trained issue, but I appreciate your honesty.
Absolutely. I think that if it comes down to, I'll be very delicate. If you go to a specific provider and that provider continually is known for not having good molds, go to another provider. It's just a matter of, it's kind of like wine. I don't know, in a sense, if you don't like it, you got to change to a different one. And when you find one that's really good, you hold on tight until that, and make sure that one sticks around. Oops, there's Jean.
Yeah, that it actually gets to another issue, because with the way hearing aids are sold, frequently, if you have not bought the hearing aid from that provider, if you try to go to another provider for ear molds, they won't do it. I can't even get another provider to change my tubing on existing ear molds. And so that's why it seems to me it's all the more important for your training boards to be much more attentive to ear molds, especially because you've got this really expensive instrument going on, and this lack of attention to ear molds, it just seemed to negate a lot of that to me. So I'm sure you know that, but I just wanted to say it. So.
No, and really the thing about the tubing is really any hearing aid dispenser in California should be able to change that tube. Not always going to be something that's free, but it should be able to be performed. But unfortunately, sorry. Oh, you saw you. Oh, hi, Sarah.
They are capable of changing the tubing, but they will say, at least I've tried it because I've moved since I bought my current hearing aids, and it's happened to me before, they will say that we didn't fit this hearing aid and we don't want to, take the risk of changing the mold. We might break your ear hook or something. We don't want to handle the hearing aid. So then they want to adopt the hearing aid, which is a high fee for me just to get new tubing. So I, as a consumer, are reduced to trying to order the tubing off of Amazon and change it myself using a hairdryer. And that's not really cool. So I'm just saying that there's a larger industry-wide issue that is not just related to fitting, but it's related to pricing and how the practices go for most people.
It's Tanya, right? Excuse me. I always called you Tanya, excuse me. I would love, to be honestly, I would love to speak to you even offline about that, because the license provided or earned and from by a hearing aid dispenser, there's certain things that we have to do. And that's one of the things that, just kind of sounds silly that it's more of the provider doing that. It's not by any regulation. There's no liability insurance. There's nothing that says that anything you're describing that they have to charge you or have to. Again, it comes down to the person sitting there. And if you don't like what they say, don't let them say it again. You know what I mean? But it's not that easy, because, there's not that. Hearing aid dispensers are coming out left and right. There isn't a training program, and we've tried at the state of California to adopt what's called ILE, which is more of a national based thing, and apprenticeship and a few different aspects. It just got shot down for funding. So, but we still try to fight the fight. So,
okay, well, that's helpful
I
to know.
appreciate that.
Thank you.
Oh, you're welcome. Yeah, absolutely.
Okay. Hi, Sarah, you're back.
Zoom just stopped.
Oh no.
Okay, I don't know what I missed. So I have some questions for you, Joe.
Sure.
Do you have auditory rehabilitation programs for your clients?
There's actually, it's a kind of a yes and a no. We do, because that's really what hearing aids are doing, is it's rehabilitating the cognition of sound and how the auditory processing works. But our scope is not something where we sit down and say, today's session is an auditory rehab session, because it's not something that we're necessarily trained to say, this is the curriculum of how you go through the auditory processing process of it. But it's actually a proven thing that when you hear, and you're hearing even at a much more accurate state than you were prior to, you're redeveloping that audio processing. The clinical type, what's caused by maybe strokes or caused by things that are outside of maybe an untreated hearing loss, those would be more for an audiologist or doctor of audiology or speech pathology, potentially even for their scope.
Okay, and your profession sounds fun and helpful. You're helping so many people. Do you need to hear well to be a hearing aid dispenser? Could you be a person with cochlear implants like myself and other people here, or could you be a person with hearing aids? Do you need to hear well to perform your job?
That's a great question. I do hear well, so I'm not sure, but the thing about it is it's an addicting profession because of the level of help you give people. And often people get into this industry because they were helped, right? They go, wow, I want to do that because now I'm wearing hearing aids and I hear better and I was not before. How do I do that for someone else? So there is a lot of colleagues that I have that have hearing impairment, and they're very successful in helping other people hear better. So I would say it's completely possible. When I've done proctoring, I have seen people wearing cochlear implants go through the process, and there's some very sharp people out there. Like, not that it's a delineating criteria, but I would say that person, I would have hired them on the spot if I obviously don't do that, but they were good at what they were doing and you could tell. So it doesn't matter on your disability, as you might know, it matters on your ability when it comes to how you're able to work with that.
Yes, okay, that's really interesting. And how does one go about evaluating a hearing aid dispenser? Because as you pointed out, there are several around. I wouldn't say we have a lot here where we live in Marin County, but there are several. What questions should we ask?
Oh, that's a good question. When it comes to, I'm going to base it on like my being a consumer that buys things myself, right? Nowadays, when you're looking for a service, let's just say I was buying a widget, right? I'm probably going to type widget into the internet, and I'm going to see who are all the widget dealers in the world, right? Or in my area. And I'm going to go through and read what other people have to say about that widget person. And it could be food, it could be anything. And when you start seeing that a lot of just genuine reviews are going through, and there's some not great ones, maybe every now and then somebody doesn't like the widgets that were done. That seems to me to be somebody who's at least doing an honest level of work they're doing. If you see only 5 stars and there's 5 of them in there, odds are that person's friends maybe came in and gave them the reviews. So I think that's how nowadays we evaluate anything. But then I feel like we should all be the first ones to review and state something so that other people know that they should go back to that widget person, that they should go back there again. And I think that's all you can do. In your visit, if you feel like you're treated well, if you feel like your hearing was treated well, then those are the big things. And yeah, tell everybody when you love it, and tell everybody when you don't. And that way we all can know who's doing the work the best there for it.
Another question. I know that sometimes practices have audiologists and hearing aid dispensers. So do audiologists, for example, do the testing, create an audiogram, and then give it to the hearing aid dispenser to fit? Is what's usual?
So there's multiple, like, I guess with really any kind of business model, there's multiple ways to go about it. I know in my family history, my great aunt Donna got us all into the industry, and she passed away in 2008, but her business partner, Donna was a hearing aid dispenser really early on. Her business partner was an audiologist, and they had that exact model where her business partner would do the hearing testing and then send her to Donna, and Donna would pick out the hearing aids for the person. If you go to a hospital type setting, you're going to probably have the audiologist is going to do both aspects, because they don't hire hearing aid dispensers under most hospital settings. But in my own case, my sister-in-law is an audiologist, and I've offered her a job more times than I can count, but she's very happy in where she works at the ENT practice that she works at. And in our area, there's a lack of audiologists, in fact, and I'd be willing to work with one if I had my hands on that opportunity. I'd be interested in it, because there is a level of stuff that, like I said, audiologists can do that we don't, and that is working with kids. And my daughter early on needed audiological services, and we had to go to the Bay Area because there's no one around here that works with children. And if they are, unfortunately, they've created a level of being competitors and not colleagues, and that's hard as well too, because that happens in this industry as well. But there's not enough audiologists out there to go around. I wish there were more, but that's the idea. It's just about the business model and how people can work together. And
then I wanted to run this by you. I read a report somewhere. I think it was intended for audiologists to read, that they're doing that there's so many people with hearing loss all over the world that they have a model where they take in people who know how to test and fit hearing aids, someone like yourself, and then they train people local people, and then bring, I guess, moderately priced hearing aids, and that they are able to provide more hearing help with that kind of model. And the idea is that hearing is, how can I put it? That hearing is very important for people who are poor.
Mm-hmm.
It's more important for poor people than people with more means. People with more means have other ways to compensate for not hearing. But for poor people, it keeps them from getting a job, you know.
I love this question because it's near and dear to what we've done here and over the last several years. There is a statistic, and I've seen it several times over the last few years, and it does show a level of hearing loss to earnable income, and it is less. If somebody does not have the best of hearing, they're also not going to be earning the most when it comes to professions that are out there. It's a proven fact. So I believe you're discussing sort of the mission type idea. And I mentioned Starkey earlier on, and I'll mention them again, is why, again, it's near and dear to my heart. Their mission has been to fit, well, in the decade of the tens, right, between 2010 and 20, they set out to fit 1 million people in the world with hearing aids through their mission process, which is really of little to no cost to the patient. And they hit it way early on, but it was domestic as well as foreign. And I know in 2000, I want to say, it was just a few years ago when I'm a 49er fan, so I'm not sure if that's going to go well on whoever likes 49ers or not, but I love the 49ers. Their new stadium was there, and the Super Bowl was being held at Levi Stadium. And Starkey put out to all of the hearing aid providers in Northern California, within earshot, that this was going to happen. And you should see if you can get people qualified to come to San Francisco and get hearing aids. And I think we had about 30 people. We had a Paradise office at the time before the fire, and we had Reading, and I don't know if I had the Red Bluff office quite yet, but anyway, about 30 people we brought of our own patients that we had tested, done impressions on, sent it all to Starkey, and we all showed up to, I want to say, UCSF down there, and we spent a day of fitting people, and not one person paid 1 penny. It was all stuff done for those that were didn't have the means to buy hearing aids. So they're not the only one. I will say I know of several groups that do these missions. Just that's the one off the top of my head that I know the name that they work with. But there's a lot of that, and there's something called the Neighbors in Need is a program right now that if you look that up, Starkey Cares and the Neighbors in Need program will help you get people that can't afford hearing aids. Ear of the Lion is another one that gets people hearing aids. So it's there, and people like myself that are like-minded, they like to be a part of that and give back and help people, because like I said, it's addicting. It's the best thing ever, is that watching someone hear better when it changes lives. It just does, as you guys have experienced in different aspects, I'm sure.
Maybe this question was asked, but what I have hearing aids now that I can't use, now that I have cochlear implants, and they're relatively new. Do you have adoption programs? I'd rather not just donate them like that. If I have a friend who could use them, if somebody would program them for her, how does that work?
There's only a few limitations on that, and that sometimes is the type of hearing aid it is. It only can be done, and I'll put a little bit of an asterisk around this because anything's possible, but the over the ear hearing aids or the RIC or the anything that hangs on top of your ear can be programmed for another hearing loss that is able to fit the parameters, and that's a broad thing to say with the correct level of molding and all that. And as we were talking with Tana earlier, it's not always something that an office is willing to do. But I mentioned the Ear of the Lion. They are a facility through the Lions Club. If in your area, you might talk to them and see if they're accepting donations. And often, like I know in our case, we've done several over the last, 20 years. It hasn't been a lot, but we've been contacted by the Lions Club in our area, and they said, we have somebody who needs hearing aids, and here are the hearing aids. Will you fit them? And they pay for the molds. That they do pay for little things about them, and then we donate our time, and it covers that. So community groups are usually the best to work with it, but you do need hearing aid dispensers that are willing to, or audiologists as well, actually, that are willing to work in those programs too.
Okay, so it's more the will of the hearing aid dispenser or audiologist. It's not like the hearing aids are broken or aren't working.
Yep.
It's just they need new programming.
There is the other caveat to that is there are, and I won't mention them by name because I don't think it's appropriate, because there's nothing wrong with the process, but there are some manufacturers or vendors that lock the hearing aids up.
Yeah.
So that can't be programmed by anybody unless they have that they're titled in that way. So that's the only other thing that happens. I've had people bring hearing aids in, and I look at them and say, I wish I could. I just can't. I can't physically get into the programming because they're locked.
Okay, well, does anybody have more questions for Joe? Is there anything that you want us to know about hearing aid dispensers or what you do that maybe you haven't said?
Well, I think it lends to what we were talking about earlier, is that there are great hearing aid dispensers, there's great audiologists, and there are some people who are just out to sell you something. And once the check clears the bank, that's all you're going to get. Those people are usually nowadays easy to kind of weed out by seeing how the reviews are, seeing how their business works, and listening to the word of mouth of other people that have utilized those sort of services. But that's like in any industry, but that's the two. It's wonderful when both audiologists and hearing aid dispensers are working together and doing things similarly, because we definitely have a lot of the same skills that work that way. And I'm absolutely so happy you guys have this association and you're supporting your association and getting education out to other hearing impaired people, because there is gray area that's out there, and the more education and the more we clear the air as to what's possible, the better outcomes we can see.